would usually start the preconception counselling visit with a discussion of physical health. Both partners need to prepare physically for the pregnancy. I would start the consultation with an assessment of the physical health of the mother. I would have a long discussion with you that would involve all the topics that you can see on the screen. Your full medical history, current symptoms, past history, past surgical history and obstetric history, allergies, contraceptions, everything. And we would also take a really thorough social history to assess any risks that you might be exposed to at the moment. A social history is incredibly important because we've got to discuss smoking, drinking alcohol, illicit drugs, nutrition, exercise, work leave, as well as potential domestic violence exposure during your childhood, and potential domestic violence risk now. We would also discuss who's in your village of support and who might help you in this next life stage. This is all important as it allows us to assess your risk and put in place supports, referrals, medications changes, and anything else that you might need before you become pregnant. It really helps to think about these things before you attend your visit so that you're ready for the discussion with your GP. We would then do a comprehensive examination of your whole body to see if there are any things that we need to address. That would include full vital signs, your weight, your height, your BMI, your waist circumference, if that's applicable. We would also use those measurements to track your weight during pregnancy and make sure that you gain the appropriate 12 to 16 kilos during pregnancy. Here, it's very important to talk about weight stigma in obstetrics. Unfortunately, weight stigma truly exists, and people who have larger bodies do encounter stigmatization and do encounter some negative comments. You are entitled to dignity and respect no matter what your body size is. And it's important to work with a healthcare team who respect you and who give you the best care possible. If you're finding that this is not your experience, it's important to raise this and to make sure that you give the appropriate feedback so that you can have a psychologically safe space to have this wonderful experience in. Then we would do a series of examinations, which would include a cardiovascular, gastrointestinal, and other examinations as required. We would do a breast exam because your hormones during pregnancy and breastfeeding change your breast structure significantly. So we would make sure that we identify any lumps that we need to ultrasound or that we need to biopsy or that we need to take any action on. We would also do a cervical screening test to make sure that you're up to date, and we would do an STI test if required. We would then encourage you to start taking your multivitamins, your pregnancy multivitamins. Sometimes I advise my patients to take it for at least 3 months before pregnancy and for the entire duration of the pregnancy. And I like the multivitamins that have iron, iodine, and folate, and that can be used for both pregnancy and breastfeeding. That way you can just stay on the same multivitamins. I would also then do some blood tests. The most important part is to check your varicella immunity and your rubella immunity. Because if you don't have adequate immunity to rubella and varicella, we would vaccinate you prior to pregnancy. I would also give you lots more information to read at home because it's very hard to discuss everything in one visit. I would give you some information about foods to eat during pregnancy and how to understand your ovulation cycle and the timing of sex. We would also initiate any referrals required, for example, to a neurologist or a specialist that you might need, or discuss things with the obstetric pharmacist about medications you might be taking, or if you haven't seen the dentist for a while, we might organize a visit from the dentist. We would also discuss vaccinations. So the vaccinations that I previously mentioned, including rubella and varicella, but would also discuss routine vaccinations such as the influenza vaccination, which can protect you from a bad influenza infection during pregnancy. For the father or the non-pregnant partner, I would also use this great opportunity to assess their physical health. I find that men especially rarely present to the doctor, especially when they're young. So this is a golden opportunity to assess their health and to support them and to put in place any supports that they might need. This would include a full history, checking any medications they're on, checking their genetic illnesses, any genetic illnesses that run in their family, taking a social history, talking to them about stopping smoking and stopping drinking alcohol in order to support the pregnant partner, and stopping smoking also in order to support the pregnant partner, but also because that increases the risk of your child developing asthma or your child developing respiratory diseases. So it's important that we use this life stage to stop any substances that might be negatively impacting your health. We also recommend stopping marijuana because that reduces male fertility by up to 30%, and it also increases the chance of miscarriage. Building healthy habits like good nutrition and regular exercise will bring you together, even if you end up deciding not to have a child. Things like trying to exercise 30 minutes a day together, or trying to do exercises like yoga and Pilates can help the pregnant partner prepare their body for labor and birth, but can also be beautiful quality time that brings you closer together. We can also discuss good food to eat during pregnancy, and you can use the handouts in order to improve your diet and improve your nutrition together. And that will serve you well, even if you decide not to go down that path and not to have a baby. Finally, in most cases, you should stop using contraception after you've had a month or so of the folic acid. Some contraceptive methods, such as the Depo-Provera injections, will continue to have an effect on fertility even after stopping, so it might take a while to conceive. I wanted to talk to you about two of my patients and what this physical health assessment involved for them. So the patients who presented for this preconception counselling visit are called Taika and Lucy. Lucy is a 30-year-old woman who came in with her husband, 34-year-old Taika. We discussed Lucy's physical health at length and didn't find any risk factors or anything that we needed to address. We did her blood tests and found that she didn't have enough immunity to rubella, so we gave her the MMR vaccine prior to conception. She had to wait 1 month after the vaccination before trying to conceive, so she went back on contraception for 1 month. We prescribed the normal amount of folic acid as she wasn't high risk. We discussed with Lucy and Taika that they may or may not decide to have a baby, but that it would be wonderful to use this time to invest in their relationship, invest in understanding each other more, and invest in building a high-quality relationship that will get them through life and that will fill both of their lives with joy. So we prescribed reading Hold Me Tight by Dr. Sue Johnson, which is a wonderful book about being aware of our attachment styles, how they manifest in relationships, and how we can build a secure attachment style with the person we're in a relationship with. Taika is a Maori man with a family history of diabetes. As part of the preconception counselling visit, he was diagnosed with pre-diabetes and referred to a lifestyle program in order to prevent that progressing to diabetes. He was so motivated to participate in the program and has already lost weight and has already achieved so many goals as part of the program. To me, this affirms how wonderful this opportunity is in preconception counselling to assess men's health and optimise their health.